Well, my friends, being the general practitioners, we have to deal with various types of diseases, including all the branches of the medical science. May it be the disease related to gynecology or skin, children or childhood diseases, senile or geriatric diseases, even some non-operative surgical diseases, etc. This is the duty and religion of the general physician to tackle, to treat all types of diseases in their daily, day-to-day practice. We have also met with various types of skin diseases every day, now and then. Skin, the outermost part of the human body, which covers and protects the internal organs from the injurious effects of the environment, from the effects of the harmful organisms of the environment. The skin is made up of 3 layers of tissue: epidermis, dermis, and subcutaneous tissues. In addition, it has also 2 appendages, that is hair and nail, and 3 glands: sweat glands, sebaceous glands, and apocrine glands. So many diseases are related with skin. We have to cover up in our everyday practice. There are various kinds of skin diseases. They are named as their origin, site, character, etc. That may be pyoderms, that may be fungal infections, that may be leprosy, that may cause due to viral infections, that may be cutaneous tuberculosis, that may be caused by arthropods and parasites, that may be due to abnormal vascular responses, that may be papulo-squamous disorders, may be autoimmune vesiculobullous dermatosis, may be metabolic and nutritional dermatosis. There may be disorders of skin pigmentation of various kinds and various forms. Skin disease also may be due to connective tissue disorders, disorders due to some physical agents, diseases of the skin appendages, genodermatosis, nevoid conditions, cutaneous tumors, and so on. One of the most important and severe variety is known as lichen, lichen planus. What is lichen planus? This is a cutaneous response over the skin, the cause of which is unknown. The histopathologic findings suggest that it is an immunological response to an agent present in the basal cell layer of the epidermis. It presents as severely itch, and the face is relatively less involved. See, this is a girl, age about 26 years, has come to treat her lichen planus, for which she has been suffering for last 15 years. It is not only over the arms, forearms, but also other parts of the body. So, lichen planus. Sometimes only the mucous membranes are involved without any skin lesions too. Involvement of the nails by lichen planus presents a slight roughness of the nail palette. But in homeopathy, like other treating the other patients, our formula is same: treat the patient by the totality, by the integrated approach of the patient. This girl represents the symptomatology, these eruptions for 13-15 years. She has developed catches cold very easily. Catches cold very easily. Headache aggravates in the sun heat. Hot patient. Desire for meat, salty foods, aversion to bitter, and fear of dogs and cats or like animals, irritable temperament, desire for traveling, thirst aggravates at night. বেড়াতে কি খুব ভালোবাসো? বেড়াতে খুব ভালোবাসে. I do not like to show her face. This is because she is an unmarried girl. কুকুর বেড়ালে কি অল্প ভয় না খুব বেশি? অনেকটা ভয় পায়. সর্দি কাশি প্রায় লাগে. সর্দি কাশি প্রায় লাগে. কুকুর বিড়ালের ভয় বেশি এবং বেড়াতে ভালোবাসে. কসমোপলিটন মেন্টালিটি represents the selection of tuberculinum or bacillinum, which was already pointed out by our Dr. Surabhuti. So tuberculinum may be needed, no doubt, because the three most cardinal symptoms, tremendous desire for traveling, catches cold very easily, and fear of lower animals represents tuberculinum. And among the divisions of tuberculinum, bacillinum especially acts over the skin very much. So bacillinum may be the choice of remedy. We may note down bacillinum. But the present other symptomatology also represents natrum neo, because catches cold very easily, also found in natrum neo. She has developed headache, which aggravates in the sun heat. She has previously had desire for bread, but now totally aversion to bread is a symptom of sodium chloride or natrum neo. Desire for bath, thirst increased, and irritable temperament, all symptoms go in favor of natrum neo. Moreover, my observations and clinical experience tells that unmarried girls are the subjects of natrum neo too. Due to mental mortification or grief or other psychogenic causes, natrum neo, strepsirrhea, etc. medicines are very important. So considering the all aspect, I do like to prescribe first sodium chloride, and bacillinum is to be kept at our hand. If natrum neo fails or cannot perform to fulfill the ideal cure. So let's prescribe sodium chloride in 50 millisiemens scale of potencies with the direction thrice in a day. Another important symptom of sodium chloride, these eruptions are dry, totally, kono rosh beroy na, no moist. So whatever may be the disease, the name lichen or eczema or erysipelas matters little to us. Our object is the symptom. the peculiarity. They are rare or strange symptoms. So in my repertory, this is the series of skin, 15 number series. The work is going on. See, I have given separately eruptions dry, Nattermure already I have given in the first grade. So eruptions dry, there are given first grade medicines given alumina, Nattermure, phosphorus and sulfur. So Nattermure covered the eruptions dry. So dry eruptions, aversion to bread, thirst aggravates at night, irritable temperament, unmarried girl, and considering headache aggravates in the sun heat, first prescription is sodium chloride. If sodium chloride improves, the succession potencies will be allowed, or not improve. Our next medicine is bacillum, which is kept at our hand. Let's see the result, my friends. I shall share you the follow-up of the case after 3 months. This is a long-standing skin disease. For last 15 years, this adolescent girl has been suffering. If by Nattermure or bacillum, this patient will cure, definitely it will once again, a great success in homeopathy, and it will once again prove the scientificity of homeopathic dynamic potencies.